Hey, welcome to the Go to Physio Sports Massage series. What I want to do in this series is give you some actionable content that you can get results. I want you to save your hands. I want you to protect your body while still being able to make changes to the nervous system. Now, before we get into the content, I want you to be aware of some important things. Sports massage is great. We're probably not breaking up scar tissue. We're probably not, doing all these crazy things, but what we are doing is we're influencing the nervous system. Now, before I show you all my favorite techniques that I've used in pro sport and in the clinic here, I want you to be aware that with hands-on treatment comes great responsibility, okay? You as a therapist need to understand the 80-20 rule, the Go to Physio 80-20 rule, which states that we spend 20% of our time and attention on the symptoms, and that's a lot of the stuff that you're going to be getting in this free sports massage course. So the symptoms, okay, that we're teaching, that we're desensitizing, we still need to make sure that we spend 80% of our attention on the true cause. So if we've got someone with knee pain, for instance, and we think their quads are tight, or they've got a reduced range of motion at that, maybe they're sensitized, the tissues around the knee joint are sensitized, and we want to desensitize with some sports massage techniques, then we obviously do that. But then straight after, we want to spend the rest of the time giving a graded exposure program to the tissues that aren't doing their job. Maybe in this case, the gastro, the hamstring, and the hip, like we've covered in a lot of our other series, okay? So please, please, please use these hands-on massage techniques with good responsibility. I was a little bit nervous about putting these out there, but I think I want to help as many therapists as I can become that go-to therapist. But please just understand, if you're doing this stuff, your patient walks out the door feeling good and the pain comes back again, you haven't addressed the true cause of the problem. We're just treating the symptoms, we're just desensitizing the symptoms. If you want to know more of that, head over to thegotophysio.com and I've got plenty of resources there for you, okay? But with that said, I hope you enjoy the course. The techniques I'm going to show you, they're the techniques I've used on world-class athletes, non-sporting patients. It's all about getting the right pressures. You can use these whether you're female, male, whether you're tall, whether you're small. It's all about just getting the right pressures, the right depths, and obviously retesting then straight after. With that said, let's get into the content. I hope you enjoy it. I'll see you on the other side. So now we're going to cover the essentials of soft tissue. Okay, now when I was a student, my soft tissue massage practicals actually consisted of us doing, I think it was about 2 days, maybe 2 hour-long sessions, and we were using talcum powder, and it was very, very kind of neurologically based. Okay, the realities is with sports massage, there's a lot of people teaching courses and they're doing this and this and this, whereas the reality is we don't necessarily need to have a massive host of specific techniques. You're going to need 1 or 2 different techniques that can be effective to bring about a change in the tissue. Now, we are going to have a separate actual lecture on this, but the key thing to understand is we're probably not changing a massive amount of the physical structures of the tissue when we're massaging, but what we are doing is we're bringing about some kind of modulation, whether that's a change in the tone of the tissue, and then we're getting the benefits in terms of increased range of movement, decreased pain, increased confidence when the athlete moves, etc. Okay, so the first thing before we actually treat the athlete is you want to have some kind of objective assessment that you're going after, okay, whether that's a generic knee flexion test that you're trying to influence, or whether it's a painful symptom that we're trying to alter the pain experience, etc. So then when you do your treatment, you then have a retest that we can go after straight away. Okay, so that's going to be very, very important. Now, the big thing with the massage, okay, is especially in sport, is we don't necessarily need to have, I remember when I was doing all my courses, effleurage and petrissage and all these different names, but actually all we need to have is maybe our hands, whether it's our thumb, to do a little bit of work, but also my forearm can be very, very valuable to the therapist, and it'll save my hands doing a lot of the hard work. Okay, so in terms of body position, they may say in courses, okay, it needs to be this height, this height, and this height. But the key thing for me is using my body weight to get a good enough force through the tissue so that I don't have to work excessively hard. So what I like to do is do some kind of lunge, okay, through the tissue. So if I'm using Pete's anterior thigh hair, for example, if I was to spend a bit of time trying to change the tone hair, getting some kind of modulation in symptoms, then all I'm going to do is I'm going to put my hand here, I'm going to sink into the tissue, and I'm just going to have my forearm do all the work here. Okay, so you can see here in this position, I'm setting myself up in a lunge position, and as I come through, all the weight is going to be on the front foot. So I'm essentially doing a lunge as I go through it. So the forces are predominantly being taken from the foot as I use my body weight to come through my forearm. Now in this particular scenario, I feel like I'm reaching a little bit too low. So I've just put the bed up, okay, it's about mid quad level here, and I'm pretty comfortable here, and I can just spread my weight from my back foot to my front foot, okay? So as I go through the tissue here, I sink into the tissue, and then I'm just going to come through like that. So it's very, very easy for me here. I'm not having to work hard. I'm almost leaning my body weight through this forearm, okay? And some of my weight's been accepted by the leg, and I'm just lunging through, okay? So I'm just going to stroke through, I'm going to lunge, I'm going to put most of my weight through the forearm, and then as I come through here, then the rest of my weight is being accepted from my foot, and I'm going to come back again, okay? I might put my hand here sometimes for a balance, but then I'm just sinking into the tissue, getting my appropriate depth, and then I'm just coming through, and then I'm accepting weight onto the leg. So I'm almost pushing my body weight through the tissue, and it's very, very easy for me. So if I had to do this for a few patients, I could probably do this for quite a while, as opposed to, you know, using my hands and all this, okay? So the forearm, very, very useful in terms of getting a lot of the tissue, to try to get a lot of modulation, sinking into the tissue and going through it, okay? Now obviously I would use oil here, okay? And we'll cover that in the next section, but that's the big thing here, is getting the body position right so you feel strong, so you can push through. Now if I choose to use my hands here, it's the same kind of concept. I'm coming through the tissue. I'm not just using my hands and shoulders all the time, so I'm using a full body movement to protect myself, and essentially it's a lunge of some sort. So that's whether it's with the fingers or whether it's with the forearm, I'm almost lunging through, okay, and I'm absorbing the majority of the forces through my midfoot there as I come through, okay? And as I go through here, okay, and then you can position the athlete as and when you need it, okay? So getting your positioning right, you being in a strong position so you can use your full body weight, is very, very important, because there will be athletes where we will need to maybe do some deep tissue work, and especially if you're quite petite in relationship to the actual athlete size, that's when then it doesn't necessarily matter what you weigh or how big you are, but if you can use your body weight to the best of its ability, that's, from what I've kind of seen from experience, the best therapists, and especially the best students that we've had on placement, the ones that can use their body weight to the best of their ability will always tend to get the best results, whether it's depth, whether it's making that significant change, okay? So just to summarize, body position, it's a full body movement, whether you're using your hands, whether you're using your forearms. We don't need to get too fancy with all these technical names. All we're trying to do is we're trying to put a force through the tissue to bring about some type of dermal neuromodulation, okay? Whether that's a change in the tone of the tissue, whether it's a decreased perceived threat, so the system takes away this protective tone and that allows an increased range of movement, or whether we bring some kind of change in the pain perception, okay? So as always, we need to understand the tissue that we're influencing, but also we need to understand that we may not necessarily be actually changing anything physical to the tissue, okay? So for the majority of it, the literature is suggesting that the majority of changes is from modulation from the higher centers. Okay, so I hope that's useful for you. What we're going to do now in the next few videos is we're going to show you specific techniques to use with various body parts so that you can become that go-to therapist. As always, remember, the sports massage techniques, they're only addressing some of the symptoms. If the symptoms are coming back again, then we need to find the true cause, okay? So with that said, let's get started, and I'll show you my favorite techniques for various body parts in the coming lessons. See you there.